Hi there, welcome to a presentation by CBH Education in our Pharmacy Revision series. Today we're going to be talking about serotonin syndrome. So serotonin syndrome is a rare but a severe condition which results in the increase in serotonin. This is a chemical that is found naturally in our bodies, and it's used or brought on by increased levels of serotonin in the brain, which are linked to several types of antidepressant and are commonly prescribed on citalopram, escitalopram, fluoxetine, paroxetine, and sertraline. And other antidepressants can include venlafaxine, duloxetine, and vortioxetine as well. And other substances which are linked to this serotonin syndrome is the use of opioid drugs, illicit drugs as well. And one of the key things is identifying this and talking to patients about this with their drug interactions as well. Because what you might find is in an OSCE situation or in a clinical practice situation, you may find a patient who has a polypharmacy review and they have not been explained about this risk of serotonin syndrome. So some of the symptoms that you need to describe to them are things like diarrhea, restlessness, profound sweating, tremor, shivering, involuntary muscle twitches or jerking, mental confusion and mental state changes, raised blood pressure, faster pulse, increased body temperature, seizures or convulsions. Because there have been cases of patients who are on numerous medications that interact, that are linked with serotonin syndrome, and then obviously it's been picked up towards the end. And it's really key that when you are doing your reviews as well, you are making sure that these patients understand the effects of taking the medications and the risk of serotonin syndrome as well. So, for example, if you're co-prescribing sertraline on some patients on the long-term tramadol or codeine, it's really making sure that you've got it there. They're being counseled on it, they understand the risks, and they know what to look for as well. Because just looking at the simple risks and even just simple counselling will help patients understand, manage their medications better as well, and also support them in terms of their therapy goals as well. Thank you very much for listening to the presentation by CBH Education. For further presentations on pharmacy revision, pharmacology, OTC medication, OTC drugs, um, the legal aspects of prescribing, please follow us on our Facebook, Instagram, and YouTube channels.